We designed this workshop to replicate on a DVD the same concepts and techniques that for years we have taught patients in our practice to help them get their mouths better, and offered to people in the workshops and in consulting with different groups throughout the United States and in Central America. And it embodies the same concepts that good Dr. Joe Phillips taught me back in 1966 when I was on the faculty at Marquette. He was a graduate student, and he's the one that showed me that you could get people to care for their mouths, make their mouths better, and end up really not needing a lot of dentistry. And so that's why this is dedicated to Dr. Joe Phillips, who died about 10 years ago, and we miss Joe, but I'm always grateful for what he's done for me and for the patients that have benefited from what he taught me. Well, the question does arise, is there really a need out there for this? Well, we thought about that for quite a while. We have come to the conclusion there really is a need for a program like the Dental Wellness Workshop, because so many people have extensive dental problems that they really don't want to have, and they just didn't have the information to be able to avoid these problems. So we hope that this workshop and these discs will help the people to avoid the problems that we're designed to combat. We'll look first at the tissues of the mouth in health, and then with various stages of disease, gingivitis and periodontitis, and the causes of those conditions, and then some steps to remove that cause, the plaque that causes the disease, with some before and after slides with the result of hygiene only, and then some of the results of long-term treatment, followed by an addendum to this program, a look at the relationship between gum disease and heart disease. We'll start by looking at some examples of very healthy mouth or gum tissues and paying attention particularly to the size, shape, color, and surface texture of the gum tissues. Here's what a close-up of healthy gum tissue would look like, and then we'll look at what healthy gum tissue would look like under the microscope. Those fibers in the connective tissue are what hold the gum tissue nice, tight, snug up against the tooth, showing that stippled or rough surface, and that tight gum over the attachment of the tooth to bone in health is what protects the whole mechanism and keeps it that way in health. The first problem we want to look at and show some pictures depicting the condition is the first periodontal condition of gingivitis, the early stage. And you can see in some of the pictures the contrast with inflamed or tissues with gingivitis compared to the healthy tissues. And we'll also look at what happens to the underlying connective tissue in the condition of gingivitis. Now contrast what the underlying tissue under the microscope looks like in health compared to what we now have in the condition of gingivitis. This is what healthy gum tissue would look like, and you can see the difference once the tissues are inflamed. The gum tissues are often red and puffy. There is sometimes bleeding of the gum tissue on probing. The underlying tissue would show some inflammation, although it hasn't progressed to the underlying bone tissue yet. And this problem starts. The initial instigator of this problem is the enemy here shown on the rubber tip, that white film of material called plaque on the end of that rubber tip, which lodges along that crevice of the teeth and gums and in the spaces between the teeth. That's the enemy. And obviously it would be better to treat this condition at the gingivitis stage before it gets deeper into the bone tissues and then leaving us with a condition called periodontitis, where treatment's going to be much more extensive and take much longer time and probably be more expensive. If the gingivitis is untreated and the condition persists, what usually happens is the inflammatory process goes deeper and deeper into the tissues. There is deepening of the pocket formation. As inflammation gets close to the alveolar bone, there is a change which produces a resorption of the alveolar bone. And this loss of bone is basically what's found in a periodontal pocket. Every time you go in for a dental examination, there should be a periodontal evaluation with a probe to determine whether or not you have pockets. If they're not being probed, you don't know whether your gums are healthy or not. And the problem with pockets is, of course, we usually find in pockets the loss of the bone that holds teeth in. And that's depicted here in a picture showing what gum tissue and underlying bone looks like when the gum is flapped back, as we do in periodontal surgery, showing the loss of the bone around the neck of this particular tooth. And of course, if bone loss goes far enough and enough bone is lost, well, that's the reason so many American teeth are lost. This cross-sectional diagram shows the progression from a healthy gum and periodontal situation through gingivitis, through periodontitis, and ultimately loss of bone, where the infection is very, very deep in the tissues. And of course, the solution to any problem consists in removing the cause and thereby also preventing a recurrence. In these initial cases with these before and afters, what is shown is the results of the patients just learning how to get rid of the plaque and cleaning their own mouths before we did any instrumentation. That was our standard operating procedure for all patients, to make sure their gums were healthy before we did any work. Here was a young businessman from the Madison area with a mouth that looks, well, perhaps a little worse than what we normally see, but because the pockets weren't too deep, his diagnosis was gingivitis. And what we did, the first step, like we do for all patients, we showed him the plaque, showed him how to remove it, and let him go for a couple of weeks. Then when he came back in a couple of weeks, he was looking pretty good. He's brushing fairly well. We gave him a few tips to make his brushing techniques a little more effective. Then we scaled and removed some of the calculus by one of the hygienists. Then let him go for another 2 or 3 weeks. Then we came back, and he was looking quite well. We polished his teeth and dismissed him because he knew he was the one that healed his own mouth. And that's the main reason that we do it this way, so that when patients get their mouths healthy, they know that it's the patient that got the mouth healthy, not us, and therefore they don't have to depend on us to be the ones that keep their mouths healthy into the future. That patient was fortunate enough that we got him in when he was at the earlier stage, just at 1 or 2 before deep periodontal pockets had happened, and we were able to treat him successfully by teaching him how to brush and just scaling away some of the hard tartar from the pockets that weren't too deep, and therefore that was enough to solve his problem. Here's the case of an elderly gentleman who'd already lost all of his upper teeth and thought he was going to lose his lowers and didn't want to do that. And boy, he was sure right. You never want to lose all your lower teeth. And he had not only inflamed gums or gingivitis, but he had deep pockets and some bone loss, periodontitis. So he needed, in addition to learning how to brush and scaling of the tartar, we had to do some surgery for him. But these pictures show just what he had done in a couple of weeks with a toothbrush only, once he knew what to do. And this just shows the difference between the way he looked when he came in and after his just brushing for 2 weeks. Here's another example of what happens to diseased gum tissue once the plaque is removed and the tissues have a little time to heal. This patient, at about 4 weeks, because he missed his 2-week appointments, which is normally when we see people, so after 4 weeks we can see the calculus visible now that used to be under the gum tissue. So at this visit, the hygienist gave him some tips to facilitate his brushing well, although he had been doing pretty well. There wasn't much he could do to improve. Then she scaled off some of the tartar that was visible and some under the gum tissues, but the pockets were so deep that we knew that we weren't going to get all the calculus off until the time of periodontal surgery. And we then went ahead and did the surgery, probably in 2 different appointments, and then he came back for follow-up visits. But he knows he was the one that made his mouth healthy, not us. One of my very favorite patients of all time was 12-year-old Teresa, who came to us, and she was very unhappy because her dentist got mad at her, told her that she was going to have to go see Dr. Duffy and he'd cut her gums off because she wasn't brushing and flossing like she should. So she was quite sad, and she admitted she had a problem. I said, well, Teresa, do you know what's causing it? And she didn't. We showed her the plaque that was causing it. We showed her how to remove the plaque, and we let her go for a few weeks. Well, Teresa sure caught on, and she did what she had to do, and after 3 or 4 weeks, she knew her gums were better. And at this point, I think all we had to do is just polish her teeth a little bit, and I think we saw her again for a follow-up in a couple of months, but she knew she didn't need us, we knew she didn't need us, and we all lived happily ever after, and I'm sure that Teresa this day still has her teeth without problems. This is the material, the white material called bacterial plaque, which is full of bacteria and their waste products, which is growing in a film of decaying tissue from the mouth. And it's this material which irritates the gums, the toxins from the bacteria on the surface, which produces the gingivitis, and in deeper periodontal pockets, it's the toxin that comes from the bacteria and their breakdown products, which produces further infection deep in the tissues and allowing inflammation to affect arteries, blood vessels, and other parts of the body, like the heart. And so the simple point of all this is that if you remove this plaque, the cause of this problem, your problems aren't going to be too bad, and you're going to prevent them from happening again, and you'll stop your condition up there at level 1 or level 2, and if you keep it off, you're going to avoid problems indefinitely. Well, we've looked at quite a bit of why to do. Now let's look at a few slides of how to do and see if it doesn't help learn the techniques of keeping your mouth healthy. In order to make learning the techniques a little bit better, you might want to have a brush in your hand and a hand mirror also, if you would like, and then anywhere along the line you want to pause, either in your computer if you're watching it there or on your television. Pause the particular slide at whatever step you are, and then go over it a time or two to make sure you have it down pat. Before we illustrate in detail the steps in cleaning the mouth and removing the plaque, it makes sense to mention that starting with checking for plaque with something like a rubber tip, I think it's an Oral-B stimulator shown here in the picture, to find out where your plaque is, to go along the necks of the teeth in between, outside and inside, and you'll have some idea where the plaque is and where you have to concentrate to put the bristles. And this is to locate the place where the plaque ends up. In addition to checking the crevice along the necks of the teeth, be sure also to check the cracks or spaces between the teeth, a common area for plaque to lodge and cause harm. Then the first step in cleaning is just to brush the teeth, with or without paste. Tops, bottoms, inside, out, upper and lower, everywhere. Just scrub the teeth. Well, that's all very good. It gets the teeth clean, but it does not, however, clean out the 2 cracks where the plaque ends up, the crevices along the necks of the teeth, called the sulcus, where the gum tissue joins the tooth, and the spaces or cracks between the teeth. So if you're talking about plaque, when you brush your teeth, you clean away the plaque, except in the two areas where it's doing the most serious harm. So in order to clean away the plaque from those crevices between the gum tissue and the tooth, you need to set the bristles gently in that crevice and gently wiggle the bristles back and forth. As unscientific as that may sound, you set the bristles in the crack and wiggle back and forth, but in so doing, you're removing the plaque that got the gums infected in the first place. Maybe the photographs of the position of the bristles on a model might help illustrate a little bit, but it's one of those techniques that it gets simple with practice, but it's going to be awkward at first. It had been for almost all of our patients. It was for me when I first learned it, but with practice it does get easy, but don't expect it to be easy on the first day. Well, that first part of the technique will clean out the crevice along the necks of the teeth, but it won't remove the plaque from the other place where plaque accumulates and does damage to the tissues, and that's the spaces between the teeth, and those then have to be cleaned also. So basically what has to be done, and I'm trying to make this sound scientific also, is you have to stick the bristles in the cracks between the teeth and gently jiggle them in and out from the outside and also from the inside, and maybe these pictures and illustrations will help show it better. To clean between the teeth from the inside is a little tricky. You have to stick the toe of the brush down in between there and flick your fingers back and forth so the bristles catch and jiggle in and out between the teeth. If you have any bridge work, this is a handy way to get the bristles around the false tooth part of the bridge and clean out that difficult space. Braces would present a similar problem. You have to use almost the same technique. It's impossible to floss a mouth that's got any braces in it, and I don't see any other way to clean that important space between the teeth and the braces other than jiggling bristles in the crack to remove any plaque and debris that lodges in there. You just can't get a young kid to floss in this very difficult area. Here I'm using a brush with black bristles, so hopefully you can see the bristles coming between the teeth a little bit better. The use of these black bristles does help indicate a little better the exact space where you need to put the bristles and the technique that you need to use to move the bristles in and out of that space to remove the plaque. Now, after taking part in this dental wellness workshop, please do not go to your dental hygienist and say, "Dr. Duffy says I should never use dental floss." I didn't say such a thing. If you say that, your poor hygienist is going to faint dead away on the floor right there on the spot. But what happens is, even though we know a lot of people can use floss effectively, many of the people who came to our periodontal practice referred in because they had gum problems, had been brushing, had been flossing, and what we usually found was people were not removing all the plaque, and they were, in addition, oftentimes hurting their gums. Here's an example of a young lady who was referred to our periodontal practice for treatment, who was very typical. She had been going to the dentist, getting her teeth cleaned, brushing, flossing religiously, with this result that we see very often. And so, in the same young lady who wasn't getting rid of the plaque, I said to her, show me what you're doing with this floss, and I'm going to see how you do it. So she took it, snapped it between her teeth, and it goes into the gum. She winced a little bit, and I said, doesn't that hurt? She says, oh God, yes, every time I do it. And so I said to her, oftentimes pain is a great indicator that you're doing something to your body that it doesn't like, and it's not very helpful. And the same situation here applies also. I didn't think this was going to feel very good either, although you had to admire her zeal. Talk about zeal. This patient was not only cleaning away all the plaque, they were about to clean away all their gum tissues too. Now, to demonstrate the proper use of dental floss, we had to do it on this plastic model because I sure didn't know how to do it effectively in my mouth. In fact, every time I do it, it snaps between my teeth. It hurts the gums and the floss shreds, and I get upset. And I don't think anybody in our office was very good at it either, and none of them liked to do it. So we demonstrated on the model. Do it gently, slide it back and forth between the teeth if you must do it. This case of a very attractive professional young lady in Madison, Wisconsin, who was sent to us by a very good dentist who's smart and a caring young man who did some fine dentistry for her and was very concerned, as was she, because 3-4 a month after the crowns and the bridges were put in, the gums kept getting sore and sore, and she kept working harder and harder with that dental floss to try and solve this problem and get her mouth better. And so the dentist referred her to our office saying, oh, come on, can you help me? I don't know what to do with this poor lady. And so we said, sure, we'll give it a shot and see if we can't help her. So it made sense as the first step to try and get her to stop flossing and then see what happened. So she did stop flossing, and as we in our office kind of suspected, after about a month, well, sure enough, her gums started to look a little bit better. And so we thought, now let's teach her how to bristle floss and see how much better she gets. So she did, to clean the spaces between her teeth. And as we had hoped and kind of thought would happen, in about a month's time, she looked pretty good. And unfortunately, or fortunately for her, she really didn't need us to do anything else, and so we dismissed her. We're not going to make a lot of money this way, but she was happy, and so were we. Well, now, once you have cleaned all the places where the plaque ends up, along the gums and between the teeth, then it makes sense to finish the job by cleaning all the places where the plaque comes from. The basic source of the plaque and the material that the bacteria grow in to produce all their toxins is the dead skin tissue that lines the mouth, the skin of the gums, lips, tongue, cheeks, palate, and it's constantly being sloughed off, and it remains there in the mouth covered by a layer of mucin. And so there is the source of the plaque, that decaying layer of skin from the mouth, and of course it ends up on the surface of the tongue, which is made up of fibers like a rug, and the decaying tissue is trapped amongst those fibers, and so that has to be cleaned as well as the whole mouth. So if there's any secret to having a healthy mouth, the secret is you have to clean the whole mouth, not just brush the teeth. That's right. Clean the whole surface. Inside, gums, lips, tongue, cheeks, palate, everywhere. And then, of course, once you get that decaying surface cleaned away, it's going to be kind of difficult to have bad breath. And just to be current, as I was finishing making this DVD, I found in the March 25th, 2010 daily paper an article by this Dr. Paul Donahue, who still thinks that bad breath is a problem, and he comes up with some rather complicated things, I think, to get rid of it. First of all, where he says flossing, which isn't going to do the job. And secondly, this tongue scraper idea that makes you glad. You really don't need that. All you really need is the toothbrush. And of course, everybody knows the secret to having a good love life is to have a clean, healthy mouth. We've always felt that for any hygiene practice, whether it be oral hygiene or general health, to be practiced, has to be able to fit into a person's lifestyle without a lot of grief or effort. It has to be realistic. And we do kind of agree with our friend and philosopher Hagar, who says that whatever you do in hygiene has to be something that's within reason. That applies to oral hygiene also. We have found that to make it within reason, 2 criteria must be met. It's got to be easy to do. The techniques have to be learnable. And secondly, it can't take a whole lot of time, or people probably aren't going to end up doing. We have found through the years that most people, after a little practice, can learn to do this technique of removing the plaque very well. Young people of all ages, older people, even impaired people, people who have vision problems, people who have hearing problems, neuromuscular problems, muscular dystrophy. It's one of those skills that once you've practiced it, it gets easy with repetition. Our granddaughter, Eiley, our youngest granddaughter, wasn't a pro at this at age 18 months, but now that she's 3 years old, she does it fairly well and can put a toothbrush in her mouth and seems to find no trouble in cleaning her own mouth. And then here's Eiley's grandfather, your narrator, who's been doing this for 43 years, and if he can learn it, we think that anyone can learn it. It's a skill that gets easy with practice. We would suggest that you do this when you're doing something else, so therefore it really doesn't take you any time. You could borrow time from things like TV watching or camping, or when you're out in the woods where you don't have water, or in your car like some salesmen live in their cars, and policemen, and any activity. Then we were in the jungles of Nicaragua and El Salvador. There wasn't any water available, so you really can't depend on plumbing for your oral hygiene program.
Brushing and riding.
And of course, what else would a young bride be thinking about other than brushing her teeth? Is toothpaste essential? Is mouthwash essential? Well, the goal of the whole program, remember, is to remove the plaque which causes the disease, and neither of these two things will do that, although we sell billions of dollars of these products in the United States every year, and a little bit of toothpaste with fluoride on it is probably good because it'll help attenuate the process of tooth decay. But the amount of toothpaste you use is you just need a smidge, and it's good to remove stains and help get rid of a coffee breath or a food odor for temporarily. No, you don't need buckets of toothpaste, just a little dab will do you. And mouthwash, I see people in the supermarket spending all kinds of dollars and walking out with gallons of that stuff every day, but I just don't see how it's useful in making the mouth healthy. In that same article in the daily paper by Dr. Donahue, one of the tips he gives for taking care of bad breath is using some of these mouthwashes like Paradex, chlorhexidine, or even Listerine, or most of these kill bacteria. The problem with that, of course, is you're killing good bacteria. That's really not going to help with the bad breath problem. You need to clean the whole mouth with the toothbrush to get rid of the decaying film of tissue. Bacteria, the good bacteria, are not your enemy. Well, for many of us adults who've had a lot of dental problems and needed a lot of restorative work, it may be too late, but for our kids and for our grandkids, I hope that the concept becomes prevalent that you ought to be able to spend your whole life without an awful lot in the way of dental problems, grief, and expense. Be able to go from like age 5 to 85 with your teeth and not having spent a lot of time, effort, money at the dental office to accomplish that. And not end up like a lot of elderly people have without their teeth. And yes, here's really the only physiologic way you should be losing teeth, and that is if you lose a baby tooth on one of your sister's hard brownies. When I first graduated dental school in 1958, I would have looked at cases like this following one and would have thought it's absolutely hopeless, but after 40 years of practice as a periodontist, I'm not surprised at anything anymore. A lot of good things can happen. So remember, initially this is the way she looked, but then we put her through the routine regimen of treatment. We taught her how to clean her mouth. We had a couple of pre-surgical visits, make sure she was brushing well. We scaled some of the calculus off, went back and did 4 quadrants of periodontal surgery, and then followed her 2 times a year, sharing her with her dental office for the next 5 years, and we took a 5-year post-op picture, and she's looking pretty good. I guess we are hammering this point home ad nauseum in this workshop, the fact that she is healthy now, not because of the work that we did, although that indeed in her case helped. She's healthy because she's removing that which made her unhealthy. She's healthy because she's keeping the plaque off that gave her the dental problem in the first place. One of the best examples of a long-term result would be the case of my sister-in-law, who, when she was about 25, moved to Milwaukee in 1966, and I had just learned the concept of oral hygiene from Joe Phillips and was using it in my practice in Milwaukee. And we got her in the office, examined her, started the treatment because she had extensive problems, and did all the right steps, showed her how to find the plaque, get rid of it. She brushed, and after a month or 6 weeks, we had scaled some of the tartar off from under the gums, but then had to go ahead and do some periodontal surgery to correct the deep pockets and to recontour the bone where she'd already lost some bone because of this disease, even at a young age. Here's a 1-year post-operative result on Rita. She's doing really well, and then through the years, I was able to follow her because even though we moved to Madison and they were in Milwaukee, we got together for family gatherings several times a year, and I brought the camera along and get pictures of Rita at 5 and 10 and 15, and continuing on through the years to see what the long-range prognosis would be, and she really kept doing quite well. Well, I thought she looked pretty good at the 36-year picture, but then we had the good fortune this year to have Easter dinner with Rita and Larry, brother-in-law and sister-in-law, and I had the small camera with me, and I was able to get a couple of pictures of her showing a 43-year post-operative result. And I'd already completed the DVD, but I was able to get these pictures and drop them in and reburn them so that they would be complete and be able to show the 43-year post-op, and then get Rita's comments about her dental experience over the last 43 years. her gum tissues really look quite healthy, and she admitted to having very few dental problems in the past 43 years. We'll hear her tell it.
After going through the procedure with Dr. Duffy, I proceeded just to continue the instructions that he had given me with brushing my teeth the correct way to do it. I'm sure I didn't do it the correct way. Didn't pay too much more attention to it than that. I would say maybe the last 5 years I have gone back to see the dentist a little bit more often.
What was it like those first 20 years when you'd go in rarely was of all your kids around the house?
The first time I went in, the hygienist said something to the effect, well, you haven't been here in a while. And I said, it's been more than a while. I mean, it was probably, and I'm going to say, I'll bet it was 20 years, where I had the calcification in the front part, but she took that out, I don't know with what, but that is the only problem I seem to have. Everything else seems to be fine with brushing the correct way, with getting the bristles in between the teeth and cleaning. Seems to have helped me. I'm getting up in age a little bit, and just paying a little bit more attention to make sure I don't end up with false teeth, which I don't want to do.
Have you since that time had to have fillings or additional gum treatment, or what else have you had to have done other than occasional cleaning of the calculus?
Not one thing. I went in for the cleaning. I have not had any cavities. I do not have anything. I don't have loose teeth. I have not had any procedure other than to go in for the cleaning, which I only did just recently.
I just realized that Rita and I have about the same time in grade, since we both learned this concept of hygiene in 66 or 67, and so we both have about 43 years of what you might call a long-term result. So it really is possible to live without dental problems forever. That is really the goal of this program. Well, Ren, I really am grateful, and I know just a thank you seems inadequate, but thanks. I really do appreciate. And I would hope that this DVD program might be useful for all the progeny of Ren and June McMains and your children and their children and their children unto the umpteenth generation, and would hopefully keep them away from the problems of dental disease.